Hi, you guys, and welcome back to our channel. Today we are here with Jill Alfrey, who is a billing and coding manager, and we are excited to talk to her about kind of what a day in the life looks like as a medical coder. Jill, thanks so much for being here today.
Hi, Katie. Thank you, and thanks for everybody joining.
So let's jump right in. Can you tell me, Jill, just what is your actual title? I'm sure I butchered it there for a second. So tell us what your actual title is and where do you work?
Okay. So I currently work for a large hospital organization within Indiana. It's Community Health Network. I've been with this network for 20 years, so practically my whole adult life. I have been the coding manager now for about 3 months, but I've been in this industry, obviously, for a long time, and I was the coding supervisor before that, which is generally a lot of the same tasks. So I did that for 8 years.
And your position now is called what?
The inpatient coding manager.
Awesome. Awesome. Can you tell us about your progression in your career path, kind of where you started, what you went to, and how you got to where you are now?
Sure. So I actually was referred by my mom, who was the coding manager at the time. She also started at the bottom. And so when I graduated high school, I didn't have a real big idea of what to do or what I wanted to do. So she said, here's a job, you can take it, make a little bit more money and have a secure place. And so I thought, that sounds great. So I worked in chart completion, which is kind of like the physician's incomplete. You're kind of following to make sure that they get the documentation in there and that they're following all the state guidelines and regulations for hospitals to be accredited. And then also I did that kind of like a release of information position as well. It was mixed together for one of the smaller hospitals within the network. And then after about 11 years, well, probably about 9 years, I was like, I really want to move up. But being that my mom was the manager, it was a conflict of interest. So I went back to school thinking that would give me some opportunity to open my horizons. And I learned that really I just enjoy management of HIM, period. So I didn't really focus on coding, but most of the time that's where you fall in the money within HIM. So I did have aspirations to move to coding. And then when my mom decided to leave community, I just thought, this is a perfect opportunity to go into this industry and get my experience. And honestly, I didn't intend to become a manager, but here I am. So supervisor job was completely new to the organization. We had nothing similar to that up to that point. I was kind of the guinea pig. So I learned a ton from the manager that was in my role previous. She was my mentor, and we just spent a lot of time honing in on the things that we knew were industry standards that maybe the hospital wasn't implementing at the time. I believe we're at a really great level now where we compete very industry standard for all hospital organizations. So we're in a good place, and we are actually rated third employer by Forbes magazine recently, so in the nation. So that's pretty huge.
Awesome. Yeah, Forbes is a big magazine. That's awesome. You said HIM. Can you tell us what HIM stands for those of us who don't know?
Sure. Sorry. Yes. So it used to be referred to as medical records. I often still refer to it that way because most people that still interpret it that way. But health information management is HIM. It's basically anything that involves the information that the patient is giving. It's obviously confidential. We want to make sure we protect that privacy and we secure records so that that information isn't being breached, especially in this electronic world we live in. So that is kind of where our industry is, and we're kind of pushing more towards that informatics industry as well, just because it kind of all rolls together anymore.
Awesome. You answered what made you decide to get into medical coding as a career. Can you kind of talk about how medical coding is used?
Sure. So there are several reasons. Obviously, reimbursement is the number one reason that people use codes. You're just interpreting language to a number and letters now. And that just gives that feedback to the insurance company, and that's how they base their pay. So inpatient is all done on a diagnosis related grouper, which is DRGs. And they basically have a set limit that they'll pay for something that ranges in those code ranges. It's all driven by how you code the account. Outpatient is all done by ICD-9 or 10 and CPT coding at least for our hospital. We don't use ICD-10 PCS codes for outpatient. And it's driven by what was done, really. So if they came in for a test, you're coding for the reason for the test. So
Awesome. Can you talk about where coding might apply? Like, what kind of different areas might you find medical coding?
sure. So, obviously medical offices, dental, optometrists use medical coding. We also use medical coding for statistical aspects. And right now, current industry topic, huge one, is social determinants of health. And that's really just keeping our communities in mind when we are using health resources. So do we have hospitals in the right areas for people who need extra health services? Do we have service areas within our network that need transportation services because they don't have a car? Those types of things. So in homelessness, just so that we can impact the community on a positive level, we're starting to see more and more of that adapted within the hospital and physician-based coding.
Definitely. What about insurance companies? Would like Humana or Blue Cross Blue Shield, do they have medical coders and billers?
Yeah, well, they have what we call auditors. So they like to come and deny for anything possible. So they don't really have specific coders, but they have auditors that are good with coding, or billing specialists that know the rules and the regulations, guidelines, those such things. And yes, I have a whole team within the network that does nothing but denials because there are just so many.
Okay, good to know. I'm sure students will be really interested to hear that. Thank you for that. What skills do you think a medical coder must possess? What top 3 things and why?
So medical terminology is huge. I mean, if you don't understand what you're looking at, that's, you're already at a start of a problem. So, and then anatomy and physiology is extremely important because you're really looking at the body systems in each of the coding sections. And so that is really, really beneficial. And then I would just say overall technology, because this world we use a lot more Excel, Microsoft Word. Everyone has email. When I started, I didn't even have an email address at the hospital. So, there's just all of those technical pieces that if you have that in your back pocket, it's just super beneficial.
I love that you said the technology piece because I feel like today that's so huge. And some people are genuinely lacking that and forget, like a lot of people are like, oh, I'm old school. I don't really want to do that. Well, that's really kind of how we're working these days. I don't know that I could work without my email in general. So I love that you said that part. What medical specialties have you coded in the past?
So I have only coded for the outpatient side of hospital. So there's hospital coding and then there's physician-based coding. And I've only ever done hospital coding. I've done physician coding in school, but it's obviously, as most of the students will learn, it's nothing like being in the real world. Scenarios are much different when you have to actually look at everything in the chart because it gives you more to think about. So I've never actually coded inpatient accounts, but obviously I manage inpatient coders, so I understand the world. I've just never actually been in an inpatient coder.
Okay.
So outpatient
Awesome.
ED and outpatient surgery. Sorry, I guess I forgot to mention that.
Okay. Okay. How would you, this will be the one that the students want to hear the most here. How would you describe a typical day as a coder from the time you get to work to the time you leave? What are you doing? Who are you interacting with? Where are you at? Are you at a desk? Are you walking around? Are you talking to doctors or answering phones, etc.? Kind of explain to us really what that looks like.
Okay. So I think it's a little different in both worlds actually both worlds of hospital and physician coding, but also in inpatient and outpatient coding. So an inpatient coder, for a hospital is going to spend a lot of time independently working, honestly, but they also spend time with CDI, which is Clinical Documentation Improvement Specialists. Those are nurses that specialize in assisting coding so that we have those clinical validations that we need to ensure that the account's going to get paid appropriately. Since we're based on DRGs, if we don't pick up every little code, it may not impact the payment, but if you're missing like a comorbid condition or something that's major, it impacts the patient's stay, it impacts the patient's reimbursement. So we spent a lot of time with using them as just just as a reference. We work with both teams, and that really just is to eliminate or help us keep the denial rates down that we get for possibly not having that clinical validation. Honestly, that's where a lot of insurance companies are looking for inpatient. If they don't have those clinical indicators, which is like the lab tests, the operative notes, the procedures, the things they did to get to the point of diagnosing that patient, then they're going to deny it. They're going to try not to, especially the higher dollar ones. So
Didn't have a reason.
we spent a lot of time with them. Yeah. And that's their job. Their job is to find reasons to not pay. So, it's our job to give them the correct codes to pay. So inpatient is that. And we never would be in the office now for our network. We have always, 15 years coders have worked at home. They were the first set of remote workers community had. They were like the test. And then several areas of HIM have gone home, but there's still quite a few professional health information professionals that do not work at home. Some of the billing or the provider physician billing specialists, those really spend more time in the office, and they probably do spend more time talking to the provider or working with the clinical staff just to make sure that if they get a denial or something's not approved or they don't have that right prior authorization, they can get that and get the provider to sign off on it right away. So little differences. And then outpatient, we all work at home as well for hospital. They don't actually spend time with CDI, but they spend a lot more time working with billing, because there's the national claim edits, there's coverage determination, local and national. Those are all edits that will happen if you don't have the right diagnoses to support the reason the patient is having an MRI or an X-ray. If you come in and you have a cough and you're getting an X-ray on your leg, they're not going to pay for that. So, right. They want to make sure there's a correlation between the two, and that's really what outpatient focuses more of their efforts on.
Okay. And I know that we had a list of what we were really talking about, but I'm going to throw one in here. So do you work from home, correct?
Mm-hmm.
Awesome. Yeah. And so what would you tell students going into roles like this? What are some huge traits that you're going to need to be able to work from home successfully?
That is a really good question. It is actually one of the things that we ask when we interview, because working from home is it's totally different world.
It is.
Everyone thinks, oh, I want to work at home. And then you go home and you're like, oh, there's laundry and dishes and kids are running in and out. And there's the noise and the dog next door.
And your bed is right over there. Yeah.
Yeah. It's very easy to get distracted at home versus when you take yourself out of home and you put yourself in the office, your brain kind of wraps around that a little better. The other thing I think that's really difficult about working at home is just time management and focus, because there's too many distractions. But I think after a few years of doing it, I got used to it. It did take me like 3 full probably years of just doing it to be like consistently productive and knowing that I'm not paying attention to the things I don't need to worry about. The other caveat to that is that my family had to adjust to me working at home.
Yes, same for me.
When COVID happened, my husband came home and we had never worked in the same house. I mean, I'd always been here by myself. So I had to adjust to having a quote unquote coworker, because he was on the phone, I was on the phone. And then I also had to have my kids, like, just because you're out of school and we have COVID, there's no daycare and stuff, that doesn't mean mom doesn't have to work, because
And
my
just
job
because you
is,
can see me does
we don't
not
quit.
mean that I'm here to hang out with you. Yeah. I remember
Right.
my family really adjusted with that too. And I'm like, if this door is shut, it better be an emergency before you open it. Like, I am
Yeah.
working, and still now, even sometimes my kids will say, "Hey mom, can you run me here?" I'm working, guys. So I
Yes.
think it's hard for our families really, and even sometimes yourself when you first start out, to be like, wait a minute, I can't go have lunch with so and so, or I can't just run out and go do this errand, or I can't do 4 loads of laundry right now because I am working. And I think that's really important for students to really think about before they get into a work from home position, because it's not always exactly what it seems. Thank you so much for answering that. That was one I just thought of. Well, just wanted to throw it in there.
Our training is all done remotely, and that's another aspect that people don't really think about. Being a new coder, you're going to go through some sort of training, even if you've been through school, because you don't have that real world experience yet. And so during that, even during COVID, our trainer liked to go into the office a few times a week to sit with people. She felt like that one-on-one really gave her that personal connection and relationship with them. So she had a little hard time, navigating the whole training in the electronic world, but we do webcams and we have consistent meetings and we do a lot of memos through Teams to keep people engaged and just up to date on things changing, because we may not be in the office where I can go, hey, we're not doing that anymore, we're doing this, or whatever. So lots of changes, even for people who have already worked remotely, there were still massive changes that came with COVID. So everyone's going to feel it. Everyone is expecting students to go through that. You honestly, as a student, have a leg up because you've been doing remote work all along. So
Yes, that is a good point. That's a really good point. What do you love most about your role as a coder?
When I was a coder, I actually just loved interpreting the documentation. Just spending that time like researching, even if because I was a newer coder, so I was still learning. And then just learning about those new procedures that come out and watching how it evolves into a code, because there are things that come up every year that do not have, like COVID did not have an ICD-10 code when it first COVID-19. And so it had to be built and it had to be released immediately. And normally we only get codes on, tomorrow, 10/1, is when CMS updates their coding. And that actually had pushed CMS to do a second update in April now. So we currently have 2 updates to codes, which makes more sense considering it's an ever-evolving world. And it's just a lot of that goes into just verifying what's right, the documentation. Physicians weren't used to documenting COVID, so it was a completely new world that we had to navigate, and that was really cool to me because that was just from ground up. I could just
always
watch
learning
this entire
too.
process.
Yeah,
Exactly.
Learning, never bored. So that's awesome.
All the time. Every day I'm still researching and looking and learning what changes are happening. It's an ever evolve. If you are not good with change, this is not your world, because this is constant change.
Yes.
And I like that. I like to be on my toes, so I don't like to get stagnant or bored. I think I did that for so long that now that I'm in the high paced world of coding, I'm like, there's no way I could sit and just code all day. But that we have a lot of people that just love to do that. They want to be left alone. They want to read their documents, they want to code, and they take great pleasure in watching that work queue decrease. So it just depends on what you like to do.
Yeah.
Yeah.
What are some tips you would give to a medical coder that is new to the industry, such as the students coming out of our course?
Be patient with yourself. You're not going to know everything. You were not taught everything. Things that they told you in school are going to go whoop, even when you thought you knew it. I think I left every day for the first 2 weeks with a headache. And I'd been in health information management for 10 years at that point. So it was really, at first, very discouraging to me, because I thought, what did I do? I was so good at what I did before. Am I not going to get this? Don't just get those out of your head, relax, don't stress. and hopefully you have a really good trainer that's willing to answer questions, because my biggest piece of advice is ask. Oh, do not assume you know, because you won't.
Yes, definitely. I love that. Last question, are there career advancement opportunities for medical coders? Can you talk about maybe a couple of those?
Sure. It depends on where you go. Some places have tiered coding, which is, an entry level coder would be considered coder one. A mid level, 5 years to 6, 7, 8 years would be a level two. Generally, those are also kind of outpatient coders, so they would code regular outpatients, EDs, outpatient surgery coders. And then 3 would be considered inpatient, because that is just technically the hardest, at least in hospital coding. They consider that the most in-depth coding. So you do have those advancements. And then if you enjoy this world, we have like a whole entire team that's built to working with our EMR, which is the electronic medical record. And they have like health information professionals specifically working on things that involve updating our systems, just because there's so much technical pieces and guidelines from us. And then obviously you have the technical part from the IT world. So they have really combined those two teams and made one. So there are opportunities that people don't even realize are related to the same thing. So branch out, explore, apply for everything. You never know. You may be in a world that you love.
That's awesome. Definitely. I think there are a million I've looked at different certifications also that you can grow into as a CBCS. After you get your CBCS, there are a million more, guys. If you're interested in those, you can check out our blog post on our website regarding that. But Jill, thank you so much. I know the students will really love, and anyone watching will really benefit from hearing this day in the life and kind of these questions about how you have progressed in your career. And we really appreciate you being here today. And thank you so much for your time.
Thanks for having me. And I am happy to answer any questions if you gain any in your comment section.
Thank you so much.